Okay, so picture this.
Mhm.
You're watching an action movie,
Okay.
and the hero's car gets T-boned by like a
No.
runaway 18-wheeler.
Whoa.
Sends the hero flying through the air,
Yeah.
metals crunching, glasses shattering. It's total chaos, right?
Yeah.
Well, today's deep dive
Oh, yeah.
is all about what happens inside the body
Right.
during those kinds of intense impacts.
Yeah.
We're talking abdominal and pelvic trauma.
Right.
And let me tell you, it's some serious stuff.
Mm-hmm.
We're going deep into a medical text
Right.
that cuts right through the fluff, gives
Yeah.
you that need-to-know information on how to handle these ticking time bomb situations.
I like it.
Think of it like this. We're giving you a backstage pass to
Oh.
the world of trauma care.
Gotcha.
It's all about high stakes,
Sure.
making those split-second decisions,
Right.
and having a whole lot of expertise to back it all up.
For sure.
So
Yeah.
first things first, we've got to talk about the difference
Okay.
between blunt trauma and penetrating trauma. It's kind of like the difference between, say,
Yeah.
getting hit by a baseball bat
Uh-huh.
versus getting stabbed with a knife. Right.
Exactly. Yeah.
One's a blunt force, the other's sharp and focused.
Yeah. And, it might seem obvious
Right.
that, like, a stabbing is incredibly serious.
Yeah.
But honestly, blunt trauma can be just as dangerous.
Really?
Oh, yeah. In fact,
Oh.
sometimes even more so.
Wow, why is that?
That.
You'd think a knife wound.
Well, because with blunt force,
Yeah.
you have this massive impact.
Right.
And it sends these shock waves through your entire body.
Oh, wow.
And it can cause this
Oh, I see.
widespread internal damage,
Okay.
even without breaking the skin.
So you're saying, like,
Imagine your organs are just getting jostled around inside.
ouch. Yeah.
Not good.
No, not good at all.
And that's why that initial assessment, when a patient comes in,
Yeah.
it is absolutely critical.
Yeah, it's like being a detective at a crime scene.
Exactly.
But the clues are hidden inside the body, right?
Exactly.
So how do you even begin to...
Well, that's where the FAST exam comes in.
The FS exam, what's that stand for?
It stands for Focused Assessment with Sonography for Trauma.
Sonography. So we're talking like an ultrasound.
You got it.
Okay.
It's basically a quick and painless way to check for internal bleeding.
Using sound waves.
Using sound waves, yep.
Wow. So it's like having X-ray vision,
Kind of, yeah.
but with sound.
Yeah, it's pretty amazing technology.
That is pretty cool.
But, for really
Yeah.
detailed imaging, we often turn to CT scans.
CT scans.
Those give us a 3D roadmap of the injuries, show us exactly what's going on inside,
That makes sense.
whether an organ is damaged, if there's active bleeding, the works.
Okay, but what about radiation exposure? I always hear about that with CT scans.
Yeah.
Is that a concern in these situations?
It's a valid concern,
Yeah.
for sure.
Yeah.
But in these life or death situations,
Right.
the benefits far outweigh the risks.
Right.
The information we get from a CT scan
Yeah.
could be the deciding factor
Wow.
in whether or not someone needs emergency surgery.
So you're saying with these high-tech imaging tools,
Exactly.
doctors can actually pinpoint the injured organ.
Exactly. We can see precisely what's going on.
And are some organs more,
And some organs
Mm.
are definitely more vulnerable than others.
like,
The liver and spleen, for example,
okay,
those are the most commonly injured organs.
really?
Yep, in abdominal trauma.
Is it because they're particularly
It's all about location.
location? Okay.
They sit right behind those lower ribs.
Oh, right.
So they're kind of in the line of fire.
So they just take the brunt of the impact?
Exactly.
And if they are injured, then what happens?
Well, with the spleen specifically,
Yeah,
doctors, whenever possible, we try to preserve it.
preserve it. Okay.
Why is that? Especially in younger patients.
What's so special about the spleen?
Think of your spleen as like a bodyguard
Okay.
for your immune system.
Okay.
It filters your blood, helps fight off certain types of infections.
All right.
And removing it, while sometimes it is necessary,
Yeah.
it significantly increases your risk of serious infections later on.
Wow. So something as seemingly small as the spleen
Oh, yeah.
can have a huge impact on long-term health.
Huge impact.
Wow. That makes those preservation efforts seem even more important.
It's really important.
Wow.
But sometimes the damage is too severe and removal is unavoidable.
Right.
But if we can repair it
Right.
and keep it functional,
Yeah.
we absolutely will.
That makes sense.
Gotta try.
It's like you always want to try to save a vital part
Yeah.
rather than just opting for a complete replacement.
Exactly.
Okay, so someone comes in after an accident.
Mm-hmm.
How do doctors even know
Right.
if there's something wrong internally?
That's a great question.
It's not like your stomach can yell, hey, I'm hurt down here.
Well,
can it?
you'd be surprised.
Mm-hmm.
Yeah, our bodies have this fascinating way of
Okay.
signaling distress, right?
Right.
And one of the ways is through something called peritoneal signs.
Peritoneal signs. Okay, break that down for me. What are we even talking about?
So imagine your abdomen is like
Okay.
a vault.
Right. Okay, a vault. Got it.
Like a really well-protected vault.
Right.
And when something ruptures inside,
Uh-oh.
it's like setting off the alarm.
An alarm. So you're saying those peritoneal signs?
They're like
Yeah.
the body's way of saying, hey, something's wrong in here.
Got it. Pay attention.
So what kind of signs are we talking about here?
So think about someone who just got punched in the gut, right?
Oh, yeah.
That instinct to tense up
Mm-hmm.
to guard their abdomen,
Right.
that's a peritoneal sign.
Okay.
Or if their stomach is super stiff,
Okay.
like board-like, you know,
Yeah,
when you
yeah.
touch it,
Yeah.
that's another red flag.
Right.
These are the body's ways of saying, hey, back off. Something's not right here.
So it's like the body's natural defense mechanism.
Exactly.
Just trying to protect itself from further injury.
Exactly. But here's the thing.
Yeah.
Some injuries are sneaky.
Okay.
Like that retroperitoneal hemorrhage we talked about earlier.
Right, right. Yeah.
Remember that? The hidden compartment behind the abdomen
Yeah.
with the kidneys and all the major blood vessels. Right?
All those important structures.
Yeah, you said it was like having a leak in a pipe
Exactly.
deep inside your wall.
Hard to find.
Right. And you don't even know it's happening.
And because it's tucked away back there,
Yeah.
bleeding in this area can be
Oh, so it's harder to detect?
much harder to
Yeah.
detect, especially if those peritoneal signs
Yeah.
aren't as obvious.
Right.
It's a dangerous combination.
That's really scary.
Yeah.
So how do doctors even catch these hidden injuries?
It takes a team,
Yeah.
real teamwork.
Okay.
We're talking trauma surgeons,
Right.
orthopedic surgeons, radiologists,
Wow. So it's everybody working together.
everybody working together
Whoa, it's like a
to piece together the puzzle, figure out what's going on.
high-stakes game of medical detective work.
Exactly.
Speaking of teamwork, our text mentions something called damage control surgery.
Ah, yes.
What exactly does that entail?
So imagine a mechanic
Okay.
trying to fix a car
Yeah.
that's still in motion.
Oh, wow.
That's kind of what damage control surgery is like.
Oh,
It's about prioritizing those life-saving measures
right.
when time is of the essence.
Instead of a complete, overhaul, you're just trying to
Exactly.
stabilize the
Stabilize, exactly.
okay.
We control the bleeding, we prevent contamination,
Right.
we stabilize vital organs,
Okay.
and we do all of this
Yeah.
with the goal of getting that patient strong enough
To where they can handle.
for more expensive repairs
Yeah.
later on.
So it's like hitting the pause button
Exactly.
on the more extensive surgery,
Exactly.
addressing the most critical issues first.
Yep. Buying time,
Yeah.
giving them the best possible chance of survival.
Okay. That makes sense.
And speaking of stabilizing,
Yeah.
our text also mentions pelvic binders.
Pelvic binders. Those still sound a bit medieval to me.
They might sound archaic,
It's
but
like a-
they're incredibly effective.
Oh, really?
Oh, yeah. Remember how we talked about
Okay.
pelvic fractures
Yeah.
and the risk of massive bleeding?
Oh, yeah. Yeah, that was scary.
Yeah.
So you're saying these pelvic binders?
So pelvic binder
Okay.
is basically a wide band
Okay.
that's tightly fastened around the pelvis
Gotcha.
to stabilize the bones and reduce pelvic volume.
So it's not just about, like, keeping things in place.
It's about putting pressure on that area to help control the bleeding.
So it's like a high-tech pressure wrap.
Exactly.
Okay.
That can be a real lifesaver,
Especially in those first few minutes after an injury.
especially in those crucial moments
Wow.
after an injury.
And all of this is happening, like, in the ER, right?
Often. Yeah.
I can't even imagine.
Fast-paced environment.
Yeah, how quickly those medical professionals have to think
Absolutely.
and act.
It's all about quick thinking and quick action.
Wow. And things can get even more complex
Okay.
when we're talking about elderly patients
Absolutely, because
or pregnant women.
now you're dealing with additional factors.
Right, that could impact treatment decisions.
Exactly.
Like with elderly patients.
With elderly patients.
Yeah.
Sometimes those signs of internal injury
Right.
might be less obvious.
Oh, wow. Okay.
Or they might have other health conditions
Yeah.
that complicate things.
And with pregnancy,
And then when it comes to pregnancy,
you're essentially treating two patients at once.
exactly, you have to consider
Goodness.
both the mother and the fetus,
So it's like a
weighing the risks and benefits very carefully.
delicate balancing act.
Absolutely.
Wow. To make sure that both patients are receiving.
The best possible care.
Yeah, that's incredible.
Every case is unique,
Right.
and these situations highlight the importance of
Yeah.
having a really skilled,
Okay.
adaptable medical team.
A team that can think on their feet.
Absolutely.
Wow. It's truly remarkable what medical professionals can accomplish
It really is.
in these high-pressure
It's
situations.
amazing what they do.
It makes you realize that knowing what to look for,
Oh, absolutely.
even as a bystander, can really make a difference.
Huge difference.
It really makes you realize that those car crash scenes in movies,
Yeah.
they're not so far-fetched after all.
No, they're very real.
Even seemingly minor accidents
That's
can
absolutely.
have some pretty big consequences.
Absolutely. Even what seems like a fender bender
Wow. Which is why
could turn out to be much more serious.
that rapid assessment is so crucial.
Absolutely. Early detection,
Yeah.
early intervention,
Yeah.
key to improving outcomes.
Totally. It's like that saying,
Yeah.
time is of the essence.
Couldn't agree more. And it's not just about
Yeah.
getting them to the hospital quickly, which is obviously important,
Right.
but it's also about
Yeah.
knowing what to look for,
Oh.
knowing what questions to ask
Yeah.
so that you can be a good advocate
Advocate for the patient.
for yourself or for someone else, yeah,
Wow.
to ensure they're getting the best possible care.
So you're saying, like, even as bystanders,
Yeah.
we have a role to play here.
Oh, absolutely.
What kind of things should we be looking out for?
So let's say you witness a car accident, right?
Huh?
And someone's complaining of abdominal pain,
Okay.
knowing the signs we talked about,
Okay.
like guarding the abdomen,
Mhm.
rigidity,
Yeah.
those peritoneal signs,
Right.
that could help you paint a clearer picture for the paramedics.
Right. So we
For
become
more information.
part of that life-saving chain of events.
Exactly.
Even before they reach the hospital.
Exactly. You become a vital link in that chain.
Wow. So it's like
From the moment of the injury
Yeah.
to the time they get to the hospital.
knowing the secret language of the body
Yeah,
can help you be a better advocate for yourself or for someone else.
exactly. Knowledge is power.
It's like having a secret weapon, right?
Absolutely.
That can help you act quickly
Yes.
and confidently in an emergency situation.
Exactly. And remember,
Yeah.
medical knowledge is always evolving.
Right.
So
Yeah.
stay curious.
Stay curious.
Keep learning.
Okay.
Never hesitate to ask questions.
Well said. Well said.
Never hurts to ask.
So we've taken this deep dive
Yeah.
into the world of
Abdominal and pelvic trauma?
abdominal and pelvic trauma.
It's not always pretty.
No, it's not, but it's something that we don't think about
Nope.
until we have to.
Exactly. But it's good to be prepared.
That's right. So as we wrap up here,
Mm-hmm.
what's that one key takeaway you want our listeners to walk away with today?
I would say, remember,
Yeah.
knowledge is power.
Knowledge is power.
Even a basic understanding of these injuries,
Mm-hmm.
recognizing those signs and symptoms, it can truly make all the difference.
It can be the difference between life and death.
Absolutely. Absolutely.
Wow. It's been an eye-opening journey
It has.
into a world that we don't often think about, but we really should.
We should.
That's all the time we have for today's deep dive.
Great chat.
Until next time, stay curious, stay informed,
Stay safe.
and stay safe.